We're joined on our house call today by Dr. Charles Friel from the UVA Cancer Center to talk about colorectal cancer. We'll start with kind of a general overview about this disease, which all of us need to be concerned about.
Yes, colon cancer is very common. It's the third most common cancer that affects both men and women. It's the second most common cancer that people die of, and it is a preventable disease.
All right, so what are some of the risk factors associated with colorectal cancer?
Well, the major risk factor you have to be aware with is age. So at age 50, and I understand you are now 48.
No,
so
I'm like 39.
So there you go. So at age 50, everybody is at increased risk for colon cancer. And that's the real key thing that you want to remember, because that's when we should begin screening. Now, there can be other risk factors if you have inflammatory bowel disease or if you have a family history of colon cancer. So your doctor may recommend screening at an earlier age if you have some of those risk factors. But the key thing to remember is age, and that would be 50.
Are there warning signs that we can look out for before it gets to the point where we need to go see a doctor?
Well, certainly if you have any symptoms, and that needs to be evaluated. And some of the more common symptoms can be associated with the colon cancer would be bleeding in your bowel movements, or if you have any change in your bowel habits. Those can be symptoms that you could be having a problem, and that should be evaluated. Screening implies that you're having those symptoms. So if you have any of those symptoms, please see your doctor, and they might recommend an evaluation earlier than that.
And so, but generally speaking, 50 years old is kind of when the screening process should begin, if there are no kind of signs coming up for you.
And as long as you don't have a family history, so if you have a direct family member, a father, mother, brother, or sister who had colon cancer, then we would recommend doing screening early. But in general, you're right. Age 50 is the key date to remember.
All right. Dr. Friel, appreciate your time tonight. Thank you.
My pleasure. Thank you.
Sharon?